Did you know that some people suffer from a spinal fracture just from bending forward or coughing, or just by a minor change of position? No fall, no trauma, just a quiet break inside the bones. That's osteoporosis. And for many people, the first symptom is a fracture in the spine. Let's talk about what's really happening and what you can do about it. Hello, I'm Dr. Arvind Kulkarni. I'm a consultant spine surgeon with a focus on minimally invasive spine surgery and endoscopic spine surgery. In this video, I'll explain what osteoporosis does to the bones, how it causes spinal fractures without warning, who is most at risk and why we miss the signs, what treatments are available including non-surgical and minimally invasive options, and how you can protect your spine for the long run. Let's start with what osteoporosis really is. What is osteoporosis and why it's dangerous for the spine? Osteoporosis is a condition where your bones become fragile, they lose density and become weak, porous, brittle. And here's the problem, you don't feel your bones weakening. There's no pain, there's no stiffness until a bone breaks. In the spine, this shows up as vertebral compression fracture where the bone collapses on itself. This can cause sudden back pain, loss of height, a stoop posture, what we call Dowager's hump, difficulty standing or walking for long, and most people complain of pain on movement. And mostly people do not even realize all these symptoms are because of fracture. They just think it's an age-related back pain. Why fractures happen without injury? So that's the scary part. When your bones become osteoporotic, even minor stresses can cause them to break, like lifting groceries, bending gently forward to tie your shoe, slipping slightly and catching yourself, or even coughing too hard. Your spine bears the brunt of weight of your upper body, and when the bone density is low, it just can't hold anymore and it just cracks. Who's at risk? It's not just older women. Of course, postmenopausal women are at the highest risk, but they are not the only ones. You are at risk if you have low calcium, if you have low vitamin D, if you smoke, if you drink excessively, if you're on steroids for long for any condition such as asthma, arthritis, skin conditions, if there's a strong family history of osteoporosis, if you're leading a very sedentary life, no exercising, have a low body weight, you have eating disorders, regardless of gender, anyone above 50 years of age is vulnerable for osteoporosis. This condition affects millions, many of whom never get diagnosed until the damage is done. How spine fractures from osteoporosis are treated? Mild fractures may heal with bracing, rest and pain control, bone strengthening medication, exercises, etc. But for moderate or severe fractures, especially if the patient has significant disability, pain, etc., we have minimally invasive options like vertebroplasty, where a small amount of bone cement is injected into the fracture site to seal the fracture and stabilize it. In some situations, a percutaneous pedicle screw rod system has to be implanted when the desired stability is not achieved. This is called MIS stabilization. These procedures are done through tiny incisions and offer rapid pain relief, especially in elderly patients who can't undergo major operation. How do we prevent osteoporosis before it starts? Osteoporosis cannot be shut, it can be only slowed. It can be sometimes reversed as well with the right habits. One needs to consume calcium and vitamin D rich diet, expose oneself to sunlight every day on a regular basis. Regular weight bearing exercises are very, very important. You should have fall prevention facilities at home. Regular DEXA or QCT, preferably QCT scans are to be done if you are over 50 years of age. And of course, medication, oral or injectable if your bone density is low. Most importantly, don't ignore back pain, especially if it comes on suddenly after a mild movement, especially in elderly people. Osteoporosis is a silent disease until it isn't, and when it shows up in the spine, it can take away your height, mobility, independence. However, with early detection and proper care, you can stop it from progressing or fracturing anywhere else, like the hip, shoulder, wrist, etc., or any other level in the spine. Please like this video if you or someone you love is dealing with bone loss. Share it with someone over 50 who thinks their back pain is just age related. And please subscribe for expert spine education you can trust before things break. I'm Dr. Arvind Kulkarni and I'll see you in the next one.